Hi, this is podcast for Stress and Coping. This will be the first installment. Patients and their families and nursing staff are frequently exposed to stressors. When stress occurs, health can be adversely affected. An understanding of stress and coping is part of nursing. Outcomes are to recognize the influence of stress on health, identify techniques to manage stress and promote coping, differentiate ego defense mechanisms and their use in managing stress, differentiate general adaptation syndrome, localized inflammatory response and immune response, discuss compassion fatigue and stress in the workplace affects nurses, identify techniques to manage stress in the workplace, and during clinical, hopefully you are using the nursing process to support a client in coping with life changes. I often use humor to cope with stress, and it gives me some change and perspective, and we'll talk about other ways of coping coming up shortly. An important part of determining whether an event leads to stress lies in the meaning that we attach to it. Stress is a physiological and/or psychological event that threatens homeostasis or equilibrium. A stressor is any event, situation, or stimulus encountered in a person's internal or external environment that necessitates change or adaptation by the person. Appraisal is interpretation of the impact of the stressor by the person experiencing the stress. So your interpretation of an event might be different than your patient's interpretation. Coping is an effort to control psychological stressors. How we react to stress depends on how we perceive and value the event, our social and other supports, and usual coping mechanisms. Homeostasis is a state of physiological balance in which the body has a chance to recover or recuperate from physical activation experienced during stress. An important part of nursing is to help promote positive adaptation in both patients and their families. Nurses need to be able to recognize stress in others and understand how people respond to stress. Many factors influence an individual's response to stressors. Remember that nurses look at health holistically, and each part influences the whole person. Internal or external stressors can disrupt homeostasis, and the body attempts to adapt. There's a video in the PowerPoint about general adaptation syndrome that I highly suggest you watch. The general adaptation syndrome involves the autonomic nervous system, which is the sympathetic and parasympathetic sections, the endocrine system. When the body experiences a physical demand in the hypothalamus, the pituitary and adrenal glands are involved. The hypothalamus secretes endorphins. Hormones act like morphine and opiates, which produce a sense of well-being. The pituitary secretes corticotrophin, which stimulates the adrenals to secrete cortisol, the primary hormone impacting stress and stress response, as well as vasopressin, which increases blood pressure. The alarm reaction, or the sympathetic nervous system, brings an increase in blood volume, blood sugar, epinephrine and norepinephrine, heart rate, blood flow to the muscles, oxygen intake, mental alertness, and can last from minutes to hours. So think of you're walking in the woods and a giant bear is chasing you. That is the sympathetic nervous system right there. In the resistance stage, the parasympathetic nervous system takes over. The body stabilizes and responds in a manner opposite to that of the alarm stage. Hormone levels, heart rate, blood pressure, and cardiac output all return to normal, and the body begins to repair damage. With a lack of adaptation, the exhaustion stage, the body is no longer able to resist the effects of the stressor, and the struggle to maintain adaptation drains all energy. So this would be if the stress comes and doesn't go away. The stress comes and stays. The physiological response intensifies, but the person has so little energy left that adaptation to the stressor diminishes. The body can no longer defend itself against the impact of the event, and if the stress continues, it damages the heart along with other bodily organs and resistance to illness. So this is really where we see people becoming ill because of their stress, because that stress now has become lengthy and will continue to impact the bodily functions, cause inflammation and immune response or decreased immune response when stress is felt over time. Reaction to psychological stress. Right away, a person encounters an event. There's an immediate process of primary appraisal or rating of an event. If this appraisal results in the event being identified as either a potential harm, loss, threat, or challenge, the person has stress. The secondary appraisal focuses on the resources or coping strategies that can meet the stress. No single coping strategy works for everyone for every stressor. The same person copes differently from one time to another. Some people do problem-focused coping when they are under stress and believe they can do something about the problem. Some people sometimes do emotion-focused coping. If the problem or challenge seems to be beyond their control, they are more likely to regulate the emotions tied to that stress. There's a video about post-traumatic stress that is in this presentation. I suggest you watch that. And I'm going to move to talking about stress management. There are a lot of different types of stress management techniques, and the goal is to have the parasympathetic system take over and try to decrease the stress. Increase endorphins to help cope with generalized stress and relax the body, soothe the mind. What type of stress management techniques have you used in the past? There's exercise that can help as a general stress reducer, meditation, emptying the mind, progressive muscle relaxation, where you start at the head and go down to the toes, clench the muscles and relax them, forgiveness and just letting it go, massage, yoga, therapy or counseling, nutrition. There's some newer studies that show a really close link between nutrition and stress. So I want to talk about, in the presentation we see kind of a little situation or question. Monty is a 4-year-old boy who has been admitted to the hospital with pneumonia. He's been to the hospital for 3 days and has suddenly started to become incontinent of urine. This is most likely a result of what ego defense mechanism? A, compensation, B, conversion, C, denial, D, regression. And the answer to that is regression. The defense mechanisms are all unconscious strategies to protect oneself from increased anxiety and stress, to protect our ego and self-esteem. You can look in the chapter. There's a box in there with the different defense mechanisms. But denial is refusing to acknowledge the truth. Regression would be returning to an earlier state of development or adaptation. So in this question, it was becoming incontinent of urine. Some children will also go back to thumb sucking. Good examples. Denial, we talked about that. Conversion is unconsciously repressing an anxiety-producing emotional conflict and transforming it into symptoms. So that would be difficulty sleeping, loss of appetite. Compensation makes up for deficiency in self-image by extenuating a strong point. Displacement transfers emotion from one anxiety-producing situation to another one that is less stressful. And a lot of times you see this with patients who become angry. So they're angry that they have cancer or that their loved one has cancer, and they're really angry at the situation, but they yell at you. So you'll see that a lot. Identification, assuming another's positive behaviors and characteristics and qualities. Dissociation, subjective reduction of awareness to one's surroundings. If you have somebody who's becoming dissociated, that means they are not living in reality. And then denying an individual the use of a defense mechanism can result in increased anxiety. So you can let them play it out and then hopefully bring them back to a better way of coping.